You are suffering with wrist pain and you're wondering why your wrist hurts. This video has to do with wrist pain and how your wrist pain is not necessarily caused by an issue in the wrist joint itself. This is Dr. Shakib, and stay tuned. All right, let's talk about wrist pain. Did you know that the health of your wrist, the function, mobility, and really it working with the rest of you is directly related to your scapula, your shoulder blades? And because of the fact that you're sitting behind the desk typing, you really are limiting the movement in your wrist, and you're really over-activating the shoulder, rolled forward shoulder joint, which causes winging of the scapula. So your shoulder blades tend to come off of your rib cage, chest area. Your chest is in the front and in the back. That's a rib cage. So you want to make sure that this is not happening. So this posture is contributing to your wrist issues. That does not mean you have a carpal tunnel now, but what it means that there is an imbalance in the muscles in your forearm and your arm. The imbalance on the outside and the inside, top and the bottom, that are limiting the function and movement in your wrist joint. So when you go to grab something, you no longer are grabbing them, or you're not utilizing your wrist joint properly. So what do you need to do other than watching your posture, which has, it's really getting into details of things. You can check out my website, YouTube channel under the playlist posture to learn more about some of the things you can do. But the immediate thing you want to go to is bend your elbow, and you just go about an inch or so below your elbow and about an inch or so towards your chest. So you're going down and towards in this direction, and start finding a sore spot. So you don't want to be moving the skin. You want to go in a little bit deeper. And as you're doing it, you want to move your wrist up and down, and believe me, you'll know if it's sore or not. So you want to go along a line towards your wrist on that latitude and altitude. So you're going to go down, and then you also are going to go closer to your chest on your forearm to kind of explore that area. And so the movements that you want to do with your wrist has to do with extension and flexion, and side to side, and rotation in both directions, supination and pronation, which is that. So you want to hold on to that spot and go through it. Once again, you're not just touching the skin, you're going a little bit deeper, and you're covering this whole area here. But do know that this is the immediate source of issues that's contributing to your wrist pain. It's not a carpal tunnel thing, but the main cause of this issue here has to do with your shoulder joint placement and your shoulder blade placement. I hope you learned something from this video. Make sure you subscribe to my YouTube channel, and you also should check out my podcast, Life and Health Matters with Dr. Shakib, which is on Spotify, Google, and Apple Podcasts. Make sure you listen to it, rate it, and you share it. Thanks for watching. Take care.